Hello, everyone. You are live with Johnathan Maness, aka the One Leg Bandit. And I'm so happy to be here with you today because I always talk about changing the world. Well, today I have a partner of mine, Stiehl Tech, with me. Dr. James Stiehl is here with me, and he's going to talk about his outstanding product, Perilav, and things that he has going on in the wound care industry. But I just want to, say that we have an angel on the other line today. I want you to take your time to listen to what he's doing because he's dedicated his life to this product. It's an outstanding product. I'm going to do a quick little video and share that with you here. And then when we come back, we'll have Dr. James Stiehl with us. Hello, Dr. Stiehl.
Johnathan, how are you?
Thank you very much for being here with us today on LinkedIn Live and all the platforms. And if you would, please just tell us a little bit about Stiehl Tech and about what you have going on over there.
Well, I founded this company about 3 years ago. I kind of went into the retirement phase of orthopedic surgery, but I really wasn't ready to retire. So I found a way to get into something else that I enjoyed doing, and that was inventing things. And I wanted to invent devices and things that could be used in the operating room to help treat wounds. I had done several hundred total knee replacements that had basically, as a specialty referral practice, had developed infection from other surgeons. And so I was developing better ways to clean these wounds up, and pulsatile irrigators, which are very, very common in the medical marketplace, are probably one of the best tools that we have. So I was developing new, and it was kind of hard because it was going to be hard to get something into the operating room. And so a friend of mine said, "Well, Jim, you should look at wound care because they have all kinds of needs, but it might be something really easy for you to do." And that turns out to be exactly what it's been. It's been easy to get a product into the wound care market. And I found a big deficiency. The type of treatment that I would do, it really isn't very commonly done. And as a surgeon, I can tell you this is a much better treatment than most other things that you could try on the very difficult wounds. So,
well, tell me a little bit. What did you come up with? I know it's been a journey and a process to get to where you are with Stiehl Tech, but what did you come up with, and what do we need to go over today?
Well, there are basically two components of my system. One of them is the irrigation system, and that wasn't the real innovation. The innovation that I had was the plastic bag that collects all the fluid that you irrigate. I learned this from a doctor in Boston, Dr. Pat Marasco. He started doing this back in 2003 and had a little system called the closed pulsatile irrigation system that he developed that did much the same thing. And I looked at his cases and I looked at his website and I saw just some of the miracles that he was treating. And I said, that would be perfect for this pump system that I'm working on. And so in the process of it, I've been developing a new pump that I'll be using probably in the next year or so. But then I had to come up with a bag system that would go along with it. So I innovated a bag system that is very nice. It's very durable, so you don't get any leakage. I use a double film ostomy tape, so it really seals to the patient. And you can do it anywhere. You can do it, at home. You can do it in a nursing home. You can do it in a wound clinic. And the bags, there's some interest in surgeons using them in operating room because it encloses the wound and basically keeps any irrigation splash that would aerosolize or get them up into the air off of the provider. So those are some of the things that we do that are beneficial.
Outstanding. And tell me, why is the product important to your practice, and why do you think it's important to the VA? Because as you know, Maness Veteran Medical focuses on the veterans, and I've saw the results from what you shared with me with this product, and we are definitely getting into the VA. It's already on the DAPA now, but what's your take on that?
Well, the VA is a very interesting environment. The patients are older, they're sicker, they have lots of diseases that can lead to serious wounds, and they're difficult to handle. So I wanted to come up with a system that could be done easily by the providers. What we know, and to me, so I started doing wound care. Well, I immediately got the hardest cases there are, the stage 4, really, really difficult. I call them decubitus, but they've been named by the wound group as the stage 4 pelvic pressure injuries. These are extremely challenging because of the other illnesses that these patients have, like chronic diabetes, heart disease, cancer, you name it. These wounds do not heal very easily. If you got a young military guy that's been in the battle theater and had a bad wound, everything's going for them. They're healthy. They've got good heart, good lungs, everything, and their immune system's normal. They heal most things. They actually do pretty well. But in this VA setting, that's not the case. You can do everything right. You can put the right antiseptic on there, or the right, product that's been told to be very effective, and they just don't work. So I would tell you that what I came up with does work in the extreme cases, the most difficult cases.
Well, Dr. Stiehl, if you would, just because a lot of people have never heard of the product, let's walk through what you would do with a patient from A to Z. If you would, just give us a quick little walkthrough of how you would handle it.
Well, if I see a wound that's in trouble, and to me, it's easy to, you don't have to imagine this. They smell, they have all sorts of drainage and brown, brown stuff coming off of them, and the patients are painful. So these, in general, I'd say would be infected wounds. And because a lot of the treatment that is done today isn't very effective in this group, they don't get better. So they, as we would call it, they stall. So how do we get them better? Well, the classic surgical treatment, I've been doing surgery, as I told you, for almost 50 years. My first IMD I did when I was a second-year medical student back in 1976. So, it's irrigating the wound and debriding the wound. So you're using tools in your hands that will clean off that debris, that stuff that accumulates with the inflammatory process as bacteria are being defeated in the wound place, but they create all this smelly stuff. And so you have to remove that stuff, and some of it will damage the tissues as well. So you have to remove the tissues that aren't healthy. They have to be taken away. And then when you're all done, you have to wash the products of the inflammatory process away, the proteases or the enzymes that cause all the smell. You've got to wash the dead white blood cells that form. You got to wash all the bacteria, and a lot of them are dead too. But all that material has to get off of that wound, because it happens to be a perfect food source for new bacteria that are sitting there on the wound. So if you leave all that goo and smell and stuff on there, the process only gets worse, because you're basically feeding the next group that's coming in. So you have to really clean the wound up, make it right.
And that's what the Perilav system does. And from what you've seen, how much time does it save in the healing process? Or, what are some of the results you've been seeing?
I've been doing this for about 2.5 years now. And I would tell you, you saw that little trailer there, those two incredibly difficult cases. They were kind of a couple of my first cases, and it was miraculous what we did. That decubitus, or that pelvic pressure injury that you saw there was a pretty good sized wound. You didn't see the whole size of it. The whole size of it was double that, because these pressure injuries, they damage large areas of tissue like that. The wound may be like that, but the area of damage is like that. So that whole area can be undermined and, as we call, tunneled. And his wound was tunneled. So we immediately got to work. The irrigator that I use is it's very comparable to a Zimmer Pulsovac. Actually, it's a copy of the Zimmer Pulsovac. And it has a tip that I used for years in revising total hip replacements. And it was a long tip, it was about that long, and you could shove it down the canal of the femur and wash it out, clean all the cement debris and all that stuff out. It was an amazing device. Well, just so happens it's perfect for getting under these tunnels. So you put it under there, and you're putting a low pressure fluid flow on that surface under there, and it's enough to push the biofilm off the wounds. It certainly makes the biofilm floating again, and it allows you to wash all the debris away. What I have seen is that these tunnels in these cases they just go away almost by miracle. It's amazing how quick the tunnels go away, because it's a reasonably healthy tissue. You got tissue on top of it, and you just got a hole in it. It just closes right up. Then you're left with a wound that's going to take a long time to heal, but it's going to be clean, and at least it'll be treatable.
Well, to every VA that's listening right now, all the procurement officers and nurses is on my LinkedIn, and we'll be seeing this down the road. If you want to see a demonstration of this, or if you need to speak to us in detail, Dr. James Stiehl's information is in the chat, or you can call me anytime at the 800 number 1-833-367-6778, or email me at the onelegbandit@manessveteranmedical.com. We either get you out samples or do a demonstration, because I've seen this with my own eyes. I'm telling you, this is life-changing stuff. And remember, Maness Veteran Medical's mission is to bring these high-quality products to the VA. It's not about making money. It's never been about making money. That always comes with success in doing the right thing. And that's what we're doing here with my partnerships. You've seen it through Moleculite. You've seen it through Stiehl Tech. And Dr. James Stiehl spending his time here to promote the message, because we know what this does. So if you want to try it firsthand, reach out. So Dr. Stiehl, continue on. Tell me a little more about the Perilav system. How long the process takes, as far as whoever's administering it, and some of the positive aspects of the Perilav system.
So the Perilav system, as I call it, I've been working on a new pump, and it's a peristaltic pump. So that was the kind of where the name came from. That device will be around probably by the end of the year. But the lavage is the other really important part of this. So you got to have a low pressure system that washes the wound. The FDA, and there was a health organization about 25 years ago that determined that if you kept pressure below 15 pounds per square inch on a wound, that there is virtually no risk or damage. And that's particularly helpful in this setting, because you don't have to be a physician or a medical resident or somebody like that to do this treatment, which is basically coded by CMS as a surgical procedure. But it can be done by mid-levels. It can be done by physical therapists, PAs, nurse practitioners. And if it's in the hospital setting, like a wound clinic, it can be done by wound nurses. Now, to me, that's the easy part. The system, it irrigates very quickly, so you can irrigate with my product that's like the Zimmer Pulsovac. I can irrigate under pressure 3 liters of saline onto an open wound in about maybe 3.5 to 4 minutes. It takes a couple minutes to pull the bag onto the leg, for example, and get it all sealed up. You put a little hole in there with a pair of scissors and stick your irrigator in. You can have that wound irrigated in about 4 minutes. All the effluent, which contains the bacteria and all the stuff you want to get rid of, stay in the bag, and you take that off. I put a cellulose flocculant, a little pack of stuff that goes down in the wound, so that then congeals that fluid so it doesn't make a big mess or get out of control until you can get it into the hazmat container. So this whole procedure, maximum, even with that difficult pelvic sacral injury that I showed on the trailer, in 25 minutes to do complete. And you've done basically a surgical irrigation that I would have done in surgery. And I would tell you, a lot of the irrigations that I did in surgery, I went back a second and third time, and I would be looking at a nice clean wound. I was still irrigating, but there wasn't any debris I had to get rid of or excise or remove. It was just washing off the potential biofilm bacteria that I left behind, or maybe some debris, that sort of thing. Just cleaning up that wound, making it as clean as possible. And it's the same with any kind of wound, whether it's a burn, whether it's an open abdomen wound. We do virtually the same thing. It's putting a lot of fluid in there and then debriding away the dead stuff that's going to probably impair healing. So that's it. That's all we do. It's very, it's cheap. This is dramatically cheaper than a lot of the treatments that I see that don't move the wounds. This will move every wound. I have not found a wound that I haven't been able to move with this system. There have been patients that have gone to the hospital that I used to work at, and they'll come back with one of these treatments. I won't name them. You probably know what some of them are. And the ones were in trouble. They were ischemic. They were not healthy anymore. So I'd say, let's throw that thing away. I don't want that on there. And so then we'd get back to wash them, and a couple of days later, they're back nice and clean again, and off they go. So
if you would, Dr. Stiehl, talk about the cost savings there. Go a little bit more in detail there compared to other type of techniques that are out there. Talk about a little bit the cost savings, if you would.
Well, the biggest cost saving, I guess, for the government, for the VA, is that we're basically doing what you would do in surgery. Because this is low pressure, you don't need anesthesia. I've had no patients complain of pain with this irrigation method. So that's really a big deal. It's efficient in that respect. So you take that cost away. You can do it. The other thing that I've learned, and this comes from the research that's been done in the last 5 years, these bacteria grow so quickly that you can do a complete 100% debridement of all the bacteria, and there'll be a few persisters left behind. In 72 hours, that bacterial mass will be up to logarithmic 8, which is they're just everywhere. So in order to get rid of the bacteria, you can't do it every 3 or 4 days. You got to do it every day to get it cleaned up to where the body can control it. Some of the systems out there, and I don't mean to name them, they recommend that you put their dressing on or their thing on, and it stays on there for 3 or 4 days. I just don't support that at all. You've got to wash them frequently. This is such a simple system. You could have a wound nurse going around the floors, and she could probably treat 2, maybe 3 patients an hour and do it every day if she needed to. So that's the other part. I would say it probably drops the cost 40 to 60 to 70% over other what I would call advanced treatments. They're trying to do the same thing but don't. It's just a cheap method of doing it.
Beautiful. And I know that you have utilized the Moleculite system. Have you been able to utilize the Moleculite system in looking at some of the wounds together with what you're doing?
Moleculite is a miracle. I mean, my technology is kind of, it's simple, highly effective, something you really need. The Moleculite is it's amazing. It is the future of wound care. So here's what we're doing with Moleculite. We're putting a violet light at 605 nanometers. Whatever. It's violet light in the dark, and it shines on the wound, and bacteria, if they get that light, that wave frequency, they autofluoresce. In other words, they light up. And so you put this device on there. It's a little iPhone that's got some gadgets on it. It is an iPhone, literally. I mean, you could Wi-Fi your wife. It's that simple. But you can see the bacteria. You can see the concentration of bacteria that are going to get you in trouble. And that's the miracle of it, because you can look at a lot of my wounds, these pelvic decubitus, and you can't see the bacteria always. You don't know quite where they are. They're usually on the skin edges because that's where they aggregate. But until I had that device, I wouldn't know how infected that wound was. I think that device really is a miracle. It will be the technology that everybody uses on every wound every day. So it's that good of a system.
And we're so thankful to be a part of it. And remember, these words are coming from us. We're just describing it, but we just want everyone to know that Stiehl Tech, Maness Veteran Medical, we are in a fight here. We're in a fight to help VA and anybody that needs this have better access to care. The way Dr. Stiehl described it to me earlier, if you was to go into a doctor's office, you would want to know that people are using this type of cutting edge technology to make sure that you're better. And that's what we're trying to do here. So Dr. Stiehl, thank you so much for, taking your time and going over anything here. Please elaborate any more before you go here. I want you to tell your message. So what else would you like to go over?
That point you just made, Johnathan, is the point that struck me. Your goal is to give the best treatment that you can for a difficult wound. Now, I got one publication that came out about 2 months ago in Advanced Skin and Wound Care. I've got another one coming out in the next month or so on the moloculite. But these are literally cutting edge treatments. So if you go to the VA and you get somebody that's got the moloculite and Jim Stiehl's Perilav system, and he's just going to town, people are going to figure out they're getting the best treatment in town. That is the most efficient, effective treatment that I know of. I'm taking these other treatments out of the room because they don't work. My stuff really works, as does the moloculite. So I think our veterans deserve this stuff. They deserve to get really good treatment. And that's it. I rest my case.
And I stand right beside you. 50 years plus of experience right here telling you flat out that this is the deal. No messing around. I mean, we're coming to you live. And the reason why we're doing this live is we're letting everyone know. See, used to be with the military and with the government, they would go on these 5-year cycles. Something could come out in that 5-year cycle, and you would have to wait for the next cycle to get on board to even sell the product. Maness Veteran Medical and a lot of small business out there that is fighting to stay alive is doing this. We're all getting together. We're making sure that the highest quality products are available, and we're ensuring that everyone in the VA knows about the product. And now, being at SDVOSB, you can come directly to Maness Veteran Medical. We're set up where you can purchase the products, get the products quickly, and you don't have to wait for 5 or 10 years, to get the product. So we are completely saving people's lives. And when I say that, I mean that. I know that products that we've gotten to the VA is definitely helping saving people's lives and limbs. And we're so thankful to be a part of that mission.
Johnathan, let me close. That guy that you saw in the trailer, that first wound, they had a wound vac on him, and they were not able to control the anus because it was about that far away. And so that wound every day was filled up with feces. And you saw it. That's what you saw when you saw the picture. And I go, oh my God, this is awful. We got the wound cleaned up. That guy had been to the hospital probably every 6 weeks since he'd been in the nursing home, septic, because of that infection problem. And I said, if we don't fix this, if we don't solve this infection problem, this guy will die. And after I started treating him, he did not, until he finally died of something else, but he did not have another septic episode for a year. So that just gives you an idea of how important this is to keep people alive. And I mean, that's why I stand by it, because I know I've got another patient that's much worse than this guy. And I've been treating him for over a year, and he has not had a septic event once in that year's time. And he's told me, he said, Doc, he says, I've been septic so many times, I've lost count. And I said, well, if you're in my care, you're never going to have that again. You're not going to get that sick. So again, I just tell you how really important this treatment is.
Well, I have a call to action. Everyone that's listening to this and will listen to this, spread this word. If it's not affecting you directly, we understand. You probably not even thinking about this, but I guarantee you someone in arm's length away from you is having to deal with something like this. And if the word gets out and everybody knows, it's just another way to take care of the problem. And that's what we want to do here at Maness Veteran Medical. We will answer any questions that you have. I will get you directly in touch with Dr. Stiehl. His information is already in the chat. He wants to be asked questions. All you got to do is call him. He will take care of you for whatever time he does have. So
one more anecdote for you, Johnathan. I was at the American Academy of Orthopedic Surgeons about 3 years ago, and I presented kind of what I was doing here with this system. And there was a major from Walter Reed hospital that was monitoring, really was the moderator of this session that I was in. And he came up to me afterwards and he said, "Doc, do you think this would work in the battle theater?" And I said, "Absolutely. I mean, that's what it's designed for. It's basically outpatient treatment." He was telling me that the average war wound in Afghanistan and some of these places, to get adequate wound treatment takes them nearly 40 hours because they got to get flown somewhere, probably Germany or wherever they go, to really get that wound debrided. And what I would do, I'd have my system in the aid station, and you'd have a medic there working on that wound. Obviously, they'd make sure that the bleeding was all controlled, but they would start cleaning up that debris, and bacteria grow. By 6 hours, you're going to see a significant bacterial contamination of any wounds. But you've got to jumpstart. You've got to get ahead of those bacteria and wash those bacteria out. We think that would have a substantial effect on the long-term outcome of these cases. My friend Dr. John Kirby at WashU St. Louis has been approached to do such a study to look at how we can prevent bacteria from colonizing and contaminating wounds like this. But again, it's simple ideas, just simple things that might help.
Well, that's a big thing. I mean, think about it like this. If you get to it, you get it cleaned up, it may cause that wound from, you may be able to heal that wound up and not have an amputation or something like that. And trust me, I'm an amputee. Thank goodness I got my knee. I can still get around. But everything matters. When you get to losing digits, you don't have many digits to lose before things get really tough. And, if we can save some limbs, that's what we're trying to do. You hear me, Dr. Stiehl?
Yeah, I'm trying to think of something else.
Oh, well, hey, look,
well, I can tell you, I am working on new projects. I want to have a system that allows you to put an antiseptic on a wound. I developed a system a few years ago that was an airbrush we used on our total knees. Basically, we clean the surface of the bone off with an airbrush, basically a CO2 brush, and it dramatically improved the cement fixation of those devices. And another device I have to think about is a device that comes from the University of Illinois. Professor June Kong developed a system called a microbubbler. And what that is are little tiny crustaceans that he coats with manganese dioxide, and then he kind of salts these things onto the wound and puts some hydrogen peroxide on top of the wound. Well, the hydrogen peroxide reacts with the manganese dioxide to create little tiny nano oxygen bubbles, and these little tiny crustaceans, they start spinning around. And he's been able to show that you can remove virtually 100% of the biofilm and the biofilm bacteria on an open wound with a single treatment. I've never seen anything like it. I think experts in the Wound Healing Society have seen this technology. They like it. But I've been working with that doctor now for about 2.5 years, and I think that'll come along as well. But we're looking for better ways, simpler ways, cheaper ways of making wounds better. And I think we've got a bunch that are really going to make a difference.
We absolutely do. And Dr. Stiehl, I just, again, thank you from the bottom of my heart, Maness Veteran Medical, for being my partner, believing in me. We really appreciate you. And we're going to continue the drive of getting you in every VA and DOD throughout the country and the world. And just thank you so much for being here with me today. I hope you have a good day.
Thanks, Johnathan.
Thank you. So everyone, that was Dr. James Stiehl, and just an outstanding man. And when I say angel, I mean angel. Do you know how much time it takes to gain that much knowledge to do what you need to do? And he's just got outstanding products. And when it comes to wounds, it's near and dear to my heart. Wounds create much bigger problems: infections, loss of limb, loss of life. And Maness Veteran Medical is really taking a strong approach to wound care and making sure that the VAs have everything that they might need for success in fighting any wound. So again, everyone, please share this video. Go to Johnathan Maness on YouTube and subscribe. Follow me here on LinkedIn. I'm telling you, my messages is reaching to everybody. I have a couple different things that I'm focusing on. Definitely all my partners with Maness Veteran Medical. But another thing is helping small businesses grow. If you're a small business out there and you have no idea what you're doing with the federal contracting, I'm a federal contracting master, having procured over $1 billion for my clients in the last 12 years. That's a B with a billion. And I'm very good at what I do. I'm just definitely in tune with my trade, okay? Like Dr. Stiehl is with his trade, I'm in tune with my trade, and I know what I'm doing. So I want to help people because I've learned by helping people grow, everything happens better in my life. You know, I get to see people grow, hire people, create jobs, create wealth, and just create happiness. And I also want to say one last thing. Make sure you're paying attention to your kids in this time of age. I'm spending a little more time focusing on my children. You know, definitely look after your kids. Make sure that they're doing good. Not only help them with homework, watch a movie with them, teach them, love them, because this is a weird time and kids don't have the type of, I don't know, I guess social interaction that we had as kids. And you just have to watch your kids and love your kids and hug your kids every day. So make sure you're giving love and reaching out. But I, again, just want to say thank you. Hope y'all have a wonderful day. Tomorrow, I have a live stream. Jennifer Oiken's going to be here and talk about woman-owned small business, growing, you know, just as a business in whole, health and nutrition. So look forward to that. Wednesday, we have Nature Sources. It's going to be here. I can't wait to share that with you. You want to talk about another product that's really helping a lot of people? That is one of them. So look forward to talking to y'all every day this week, and I hope you have a wonderful day. The One Leg Bandit is out.